Hi there, welcome to our podcast series, Beyond the Diagnosis, focusing on embracing life after cancer through Sanford Health survivorship programs. I'm your host, Courtney Collin with Sanford Health News. We're glad you're here. Once a patient hears those words, "You have cancer," that patient becomes a survivor. Through my conversations with health providers on topics related to survivorship, we're learning more about how Sanford continues its commitment to help people live their best life beyond the diagnosis. Our topic today is all about lifestyle as medicine, and I'm so pleased to have two guests to talk about this. First, Dr. Shelby Turstrip, a medical oncologist at the Sanford Roger Maris Cancer Center in Fargo, specializing in breast cancer and survivorship care, and Alexis Allen, Senior Wellness Program Specialist with Sanford Health Plan, also in Fargo. Thank you both so much for joining me and for being a part of this conversation.
Thanks for having us.
Thanks so much for having us here.
Alexis, I'll begin with you to learn more about your role in Fargo.
Sure. So my role in Fargo here is I'm a registered dietitian. I work with patients with the Sanford Health Plan. That's primarily who we serve over here. Also got a extensive background in overall wellness. So that is kind of my role here in Fargo. And our primary patient population is those with hypertension, hyperlipidemia, metabolic syndrome, prediabetes, type 2 diabetes, depression and or anxiety, as well as an obesity of 30 or greater. So that is kind of the patient population that we reach out to here. But we've also got lifestyle medicine specialists and registered dietitians in Bismarck, Sioux Falls, as well as the rural communities.
And then talk about where the Center for Lifestyle Medicine comes in.
What I'll do is I will visit with a patient for the first time for about an hour, and we will touch on the 6 dimensions of wellness. So we'll kind of take an inventory of, where they're at with their overall wellness. So we've got, the 6 dimensions, of course, is physical, the one that you would expect, but we also touch other topics such as financial wellness, social wellness, community, career, and emotional wellness, just because when you kind of get into it, it all ties together with overall wellness. And then from there, we will create a plan and we'll put kind of a time on that. That's always subject to change based off of the patient's needs. And that plan is really just to indicate what the patient's long-term goals are as far as their overall wellness goes. So it's very patient-led, and the specialist is there to provide guidance and education for that patient. And on average, I would say that we visit with these patients every week or every other week, depending on their needs, for about 4 to 5 months or until they feel like they have reached their goals.
Dr. Turstrip, why is this concept of lifestyle as medicine and the Center for Lifestyle Medicine at Sanford so important for patients?
Well, I am so excited that we have this here now because the data for cancer patients and prevention and survivorship is really, it's really crazy actually how important it is in the long-term outcomes for our people. When we look at prevention, we know that healthy lifestyle can prevent up to 40% of cancers. So if we don't address this, we're really missing the mark. In addition, when we look at people who've already had cancer, if people are obese, they have an increased death rate with their cancer. And if they are sedentary, they have a 22% increased death rate. So if we don't focus on this, we really are missing a major part of effective treatment for their cancer. The other aspect of it is that we know from all the research that's coming in is that these are, some of the most important aspects of improving people's quality of life. So it helps with anxiety, depression, it improves mood, it improves cancer-related fatigue, and also improves their physical functioning. So it's a very effective treatment.
Tell me about some of the outcomes that you see through this program and what makes it so successful.
Yeah, I'm actually really glad you brought up quality of life because that is something that we really like to kind of touch on through the lifestyle medicine program. And we do measure some quality of life metrics and outcomes, such as energy levels, quality of sleep, overall emotional wellness. But we've kind of been in this program had it up and running for just over a year now. So we've been really fortunate to get some solid metrics and statistics and outcomes through the program. So just to list a couple of those off that we are really proud of is that the patients that graduate our lifestyle medicine program with an obesity diagnosis were able to reduce their BMI by, on average, 4%, which is really great. We also have found that lifestyle medicine patient graduates with a type 2 diabetes diagnosis have reduced their glucose by about 59 points on average, so for a 32% reduction. And that moves them from the type 2 diabetes glucose range down to the pre-diabetes glucose range.
Wow.
Yeah, we're really excited about that. Our last goal with the lifestyle medicine program is not just to give them the education and send them on their way. It's to kind of create those long-lasting habit changes that are going to, last them for years to come. And our last metric really demonstrates that by showing that our lifestyle medicine graduates were able to increase their physical activity by 106%. So those are kind of some solid outcomes that we have been able to show the success of the program over the last year and a half.
Wow, that is amazing, Alexis. Dr. Turstrup, what is it like to see these numbers?
And this was the first time I saw the numbers today, and I was like, oh my gosh, this is fantastic. Because, really coaching, we know, is such an important piece of changing your lifestyle, because everybody's different, and the factors that affect them and make it difficult for them to change unhealthy behaviors, really, you have to go on a one-on-one basis. So I think the fact that these coaches can really design a plan that's specific to that person's needs, and then also help to work with them to uncover barriers and work through those barriers. And then when you see these outcomes, it's like this is working. This is really amazing metrics. And if our patients, if all of our cancer survivors go through this, they're really going to be reducing their risk of recurrence and their risk of a secondary cancer, because we know in cancer survivors they have a very high risk of a second cancer. So we need to try to prevent that as well.
Alexis, walk me through the process of getting patients involved in the Center for Lifestyle Medicine.
Yep, so there are a few different ways for patients to get involved. On the provider side, they are able to place a referral through Epic by typing in lifestyle medicine, and they can select one of the diagnoses are listed on Epic. So the ones that I'd mentioned: hypertension, hyperlipidemia, metabolic syndrome, prediabetes, type 2 diabetes, anxiety, depression, a BMI over 30, or cancer. So they are able to place it through Epic. If patients are interested in this program, they are able to ask for the referral. The patients that we primarily serve are Sanford Health Plan insured patients. So with those patients, they are able to receive this through their wellness benefits at no charge. However, for non-Sanford Health Plan patients, we do have programs such as the Diabetes Prevention Program, which has a lot of research behind that, as well as Exercises Medicine, which is a 12-week exercise program that we host in person and virtually right now. So those are available for our non-Sanford Health Plan patients, but for any patient that is interested in this, talking to their provider and having them place that Epic referral is the best way for them to get involved.
And on the medical oncology side, Dr. Turstrup, where and when do lifestyle and wellness fit into a patient's treatment plan?
When I think about developing a treatment plan for my patients with their cancer, their lifestyle is always incorporated into that treatment. So we think about the chemotherapy, the radiation, and the surgery, but then it's okay. What type of connections do you have? How we do talk about financial health, because that's very important, and then looking at exercise and nutrition. So that is a conversation I have at the very beginning. The problem is we didn't previously didn't have a resource to be able to have that type of coaching, which we know is the most effective form of habit change. So I think addressing it at the beginning and then also addressing it at the end of treatment is what we typically do. We have our survivorship clinic will be referring patients as well to this program. And then really thinking about it every step of the way. I think, people's lives and habits change over time. And so if, people are kind of going off track, really thinking about it each time we're seeing someone, so that we are, getting them into an effective change management program. Medicine should be looking at what's the underlying problem here and how can we prevent issues from happening. And I think this is one step of that process.
How can somebody find support through the Center for Lifestyle Medicine or any additional resources in their community?
I think the first thing is just having that conversation with their provider that I am feeling a little, lost. I've been told this, I've been told that. I have all these conditions. I'm not sure what to do. Having that conversation is really opening the door to this program. And I think one of the greatest things about this program is on our back end, we're focusing on the metrics and making sure that we are reducing that second occurrence, or we are kind of being preventative. But on the patient side, they are, increasing their quality of life and maybe able to do activities of daily living more comfortably or keep up with their grandkids. And so having that initial conversation is, I think, one of the first steps in finding that support that's needed. And then throughout the program, we really like to provide that support to the patient on an ongoing basis.
The other thing I think they can access, for free right away is the Sanford Health Cancer Survivorship Facebook page, which is really a page that is used to, help promote these type of services, including other services for cancer survivors like education efforts and retreats that really focus on connection and connecting people with these type of resources.
Yeah.
So that would be an easy thing to just, like us on that platform as well.
Yeah, what else do you want our listeners to know on this topic of lifestyle as medicine?
One of my mentors when I was in training used to always say our job as an oncologist is really to help people live as well as possible, as long as possible. And well is first. And so I think we really need to focus on living well and what does that mean for each person and how can we be supportive in doing that. And I think this program is a great resource for doing that.
I think one thing also that is really fantastic to focus on is creating that long-lasting habit change and kind of, flipping the perspective of wellness is not something that we have to do. It's something that we get to do. It's something that we enjoy to do, and kind of making it a positive experience and not so much a chore for those patients, and kind of making it, I want to be well. I want to do these things. I want to incorporate exercise and fuel myself with good nutrition.
Wonderful. Alexis Allen, Dr. Shelby Turstrup, what a fantastic program and great conversation. The more we can talk wellness, the better. Thanks so much for your insight and for all that you do.
Thank you so much for having us.
Thank you.
This was another episode of our Cancer Survivorship series, Beyond the Diagnosis. I'm your host, Courtney Collin. Stay well. We'll see you soon.